Hello, and welcome back to our channel, where we explore the fascinating world of science and technology. In today's video, we're going to delve into a topic that affects many of us at some point in our lives: misconceptions about X-rays. Before we proceed to this video, don't forget to hit the like button, share to your friends, subscribe to Earlyseven's YouTube channel, and click the bell icon for more rad-clusive videos. X-rays are an incredible tool in the medical field, allowing us to see inside the human body without invasive procedures. However, there are several misconceptions that surround this powerful imaging technique. So, let's separate fact from fiction and debunk some of the most common misconceptions about X-rays. Misconception number 1: X-rays are harmful and dangerous. Many people believe that getting an X-ray exposes them to dangerous levels of radiation. While it is true that X-rays involve ionizing radiation, the amount of radiation used in a typical X-ray examination is relatively low. Radiologists and radiologic technologists take precautions to ensure the patient's exposure is minimized, such as using lead aprons and collimators to focus the X-ray beam. The benefits of X-rays in diagnosing medical conditions far outweigh the potential risks associated with their usage. Misconception number 2: X-rays can see everything. X-rays are undoubtedly a valuable diagnostic tool, but they have their limitations. They are particularly useful for imaging bones and identifying fractures, joint issues, and certain diseases like pneumonia. However, X-rays are not very effective in visualizing soft tissues, such as muscles, tendons, or organs. For those areas, other imaging techniques like ultrasound, CT scans, or MRI scans are better suited. Misconception number 3: X-rays are only used in medical applications. X-rays have significant applications beyond the medical field. While they are widely used in healthcare for diagnostic purposes, X-rays also find applications in security systems, industrial inspections, and even in space exploration. In airports, X-ray scanners are used to examine baggage for prohibited items. In manufacturing, X-rays are used to detect defects in products or to analyze the structure of materials. In space exploration, X-ray telescopes help astronomers study distant celestial objects and phenomena. Misconception number 4: X-rays can cause mutations or cancer. This misconception is related to the misconception that X-rays are harmful. While it's true that ionizing radiation can potentially damage DNA and increase the risk of cancer, the amount of radiation used in diagnostic X-rays is carefully controlled and considered safe. The benefits of an accurate diagnosis from an X-ray far outweigh the minimal risk associated with the procedure. The radiation dose from a typical X-ray examination is comparable to the background radiation we are exposed to in our daily lives. Misconception number 5: Pregnant women should avoid X-rays at all costs. It's a common belief that pregnant women should never have X-rays. However, the truth is a bit more nuanced. While it's true that excessive radiation exposure can harm the developing fetus, the radiation dose from a single diagnostic X-ray is very low. In cases where X-rays are necessary to diagnose a medical condition, radiologists and obstetricians carefully weigh the risks and benefits and take precautions to minimize radiation exposure to the unborn child. Misconception number 6: X-rays are outdated technology. With the advent of more advanced imaging techniques like CT scans and MRI scans, some people believe that X-rays are outdated and no longer used. However, X-rays remain an essential tool in healthcare. They are cost-effective, easily accessible, and provide quick results. X-rays are often the first step in diagnosing a condition, helping healthcare professionals determine if further imaging is necessary. Misconception number 7: X-rays are painful. Many people fear that getting an X-ray will be a painful experience. However, the truth is that X-rays are completely painless. The process involves positioning the body part of interest between the X-ray machine and a detector, and the radiologic technologist will instruct you on how to stay still for a few moments during the exposure. The X-ray machine emits a small burst of radiation, which passes through your body to create an image on the detector. You won't feel anything during the procedure. Misconception number 8: X-rays are only for bones. While X-rays are excellent at visualizing bones, they are not limited to bone imaging alone. X-rays can also be used to diagnose and monitor conditions involving the lungs, chest, abdomen, and other areas. X-rays can help identify conditions like pneumonia, lung infections, tumors, kidney stones, intestinal blockages, and more. They provide valuable information to healthcare professionals and assist in determining appropriate treatment plans. Misconception number 9. X-rays can reveal all types of diseases. While X-rays are useful in detecting certain conditions, they have their limitations. X-rays primarily show the structure and density of tissues. They are not as effective in identifying early-stage diseases, such as some forms of cancer. In those cases, other imaging techniques like CT scans, MRI scans, or PET scans are often necessary to provide a more detailed and comprehensive evaluation. Misconception number 10. X-rays are always necessary. There is a misconception that X-rays are routinely performed for every medical situation. In reality, healthcare professionals follow a responsible and evidence-based approach to determine when an X-ray is truly needed. They consider the patient's symptoms, medical history, and other relevant factors before deciding to proceed with an X-ray examination. Unnecessary exposure to radiation is avoided, and alternative imaging methods may be recommended if they are more appropriate for the specific case. And there you have it, folks. We've debunked some of the most common misconceptions about X-rays. It's important to separate fact from fiction and have a better understanding of the benefits and limitations of this essential medical imaging technique. Disclaimer: the information provided in this video is for educational purposes only and should not replace professional medical advice. Always consult with a qualified healthcare provider for personalized guidance and treatment. If you found this video valuable, please give it a thumbs up and consider subscribing to our channel to stay updated with our empowering content. Thank you for watching, and see you on our next video.